Welcome back, everybody. This is Dr. Robert Boyston from the Boyston Institute, and we're going to continue on our series with covering the 7 deadly fibromyalgia treatment mistakes that most patients make when they're looking for a solution to their fibromyalgia. Now, in the first part of this series, we discussed how the first mistake is accepting fibromyalgia as the label for all of your symptoms, and we discussed how by accepting this label that doesn't really mean anything specific, doctors start to push your symptoms to the side and they stop looking for answers. And that's a huge mistake, and it's going to lead to big problems down the road. Now, the second big mistake that patients make when they're looking for an answer to their fibromyalgia is falsely believing that all of the correct tests have been done and that everything on your lab reports is normal. See, this is a huge trap fibromyalgia patients fall into that you must absolutely avoid. See, where my institute is located in California, many of my local fibromyalgia patients have traveled to one of the big diagnostic clinics, such as Stanford Medical, the Sansum Clinic, or UCLA Medical. And they go there, they spend a couple days doing tests, and then they come out with the same thing they had before. A report that says the labs are, and I put this in quotes, normal, and a continued diagnosis of fibromyalgia. See, then the patient's satisfied. They feel that everything has been done, and they continue on the path of taking medications or just living with the pain, the fatigue, and the rest of the symptoms that go along with it. See, the truth is that 0 functional testing has been done at this point. They may have ran MRIs and they didn't see any obvious abnormalities. They didn't see tumors. They didn't see any lesions. Then they ran blood work and it didn't appear to be abnormal on the surface. And then they call it a day. And if you accept that everything has been done, then you have lost at that point, because you're going to stop searching for answers and information that will help you start feeling normal and living good again. See, you may never make it to a doctor who does functional testing and will look at all the functional ranges and put all of the pieces together for you. So that's why it's so important not to think that everything's been done, that my doctor has checked everything and this is my diagnosis and I just have to live with it. Or I just have to live with these medications and all the side effects. There's more to it. There's got to be an answer, and there's an answer there if the proper approach is taken, if the doctor or the health practitioner that you're seeing gets to a functional diagnosis, a diagnosis where something can be done. So that's pitfall number 2, big trap. So don't get stuck in that trap of falsely believing that everything's been done, because most likely it has not.